Contact lens related corneal ulcer. Should I scrape? The general rule of when to consider performing a corneal scrape is if you have an epithelial defect or infiltrate which is greater than 1 millimeter in size. However, if there is an atypical infiltrate, an atypical history, or you think about needing a corneal scrape, the answer is that you probably should do a corneal scrape. Larry Benjamin always says, well, in cataract surgery, if you think about using a surgical adjunct, then you should use it. And I think the same applies in this instance. If you think that something seems a bit atypical and you think you might need to do a corneal scrape, then the answer is you probably should do a corneal scrape, because later down the line, it will really save you a lot of headache if your patient isn't responding to initial therapy and there appears to be diagnostic confusion as to whether possibly there is an atypical organism causing that patient's infection and they're not responding to treatment. Because sometimes there can be a lot of confusion as to which antibiotic therapy is the most effective or whether antifungal therapy or other treatments may be useful. So here we do have a fairly innocuous looking infiltrate, probably around 1 millimeter in size, so you probably don't need to scrape, but bear it in mind.